Marks. I'm an emergency physician who's been
Into the microphone.
I'm an emergency physician who's been practicing here since 2006. I would just like to say that since starting this year, it has become increasingly difficult to take care of patients once they get to Willits or to Ukiah. We have to remember that Willits is a critical access hospital and does not actually give a lot of services that our community needs, and they need to be transferred to a higher level of care. And those patients are getting delayed. As Teresa said, level 2 stops the transfers. So even when you get the patients to us, we can't get them to care, definitive care. And patients have been harmed by this. We've seen it over and over again. It has become very difficult, and I'm sure that that's why Dr. Matheson is here today as well. So when you said, is there a shortage? Is there a problem? Yes, because when you have those 911 responses, that's great. They come to a critical access hospital or to Ukiah. I practice at both, where again we have limited services. We do not have a lot of specialists, and they need to go outside of our 2 hospitals. We can't get them there. They have been delayed hours to the point of deterioration when we then try to get a critical care helicopter, which is also delayed, right? So it's been a problem. Thank you.
So,
Hold 1 sec. Supervisor Williams.
so I've received some criticism over my agenda summary where I'm claiming patients are actually harmed by the current system and that they can't get the appropriate level of care, that the transfer is not timely or the 911 response isn't timely. Would you say that's accurate, not just theoretical, but that it's happening today?
Absolutely.
Thank you.
I think that Amy Buckingham, Rebecca Danao, Lindsay Spencer would all be able to back those with real cases. And I know personally I've had those cases.
Supervisor McCowan.
Thank you, Mr. Chair. Could you differentiate between inter-facility transfers and stat transfers?
So interfacility transfer, so this is, you have to think about this in terms of, we have a patient who needs a bed, maybe for a medical problem, right? We don't have a bed at Ukiah, but there's a bed at Howard. We've gone both ways, right? The patient can be stabilized in our emergency department, but will be much comfortable when they aren't sitting on 1.5 inches of foam. That's different than a trauma patient or a stroke patient that could benefit from intervention, or some other, or GI, because we don't have GI call. Those patients need immediate services, but those patients are still being delayed, often hours, for definitive care.
My understanding was that when we go to level 2, then the inter-facility transfers are on hold, but a stat transfer could still be called for and an ambulance would respond. Is that not accurate?
So you have to understand what you're now asking our people to do. Are you going to take a patient out of the system, I mean an ambulance out of the system, for a transfer down to St. Helena or a transfer down to Santa Rosa from Willits? So that's a 3.5 or 4 hour turnaround, right? It's an 1.5 hours down there. And how stat is stat? I felt the patient needed to be stat transferred, and the nurse manager in the ED was saying, well, but it's going to take the ambulance out. We're down to a level 1. We can't do that, right? And so you have these moral and ethical dilemmas. I'm going to tell you, it's made it very difficult.
But you, I would presume, would be making your decision on what's the best interest of that patient that needs the trauma
right?
care.
I did, yeah.
Well, then you'd call for a stat transfer, I would
We
think.
did, right? And then and then what's the impact from every other person who might need to have a 911 call? It's made it very complex and complicated.
Thank you.
Yes.
Thank you.